Ask AJ. Hi everybody, welcome back to Ask AJ. I'm AJ Hanna from Sykes. And year 2020 has added a lot of new terms to our language. Terms that aren't necessarily new, but because of the pandemic that we've been experiencing through the course of 2020, terms like COVID, terms like social distancing have become much more commonly used in conversations or in instructions from health officials as we work our way through this current pandemic situation. One of the other terms that we don't hear quite as much, but has become more and more vital as we progress through the year 2020 is contact tracing. Now, contact tracing is not new to COVID-19. As a matter of fact, contact tracing is used anytime there's large outbreaks, whether they're local, national, or global, to try to identify as many people as possible who may have been in contact with an infected individual. You may have read or heard about the case of the Biomed conference in Boston earlier in 2020 and how they traced people back to their home cities and their home states who ended up being infected or may have been infected along the way. And contact tracing really is just a way in which they can attempt to notify anyone who has potentially been exposed to virus that they are at risk. So state or a local health department may contract with an organization similar to Sykes, whose job will be to take information that's been collected from a case of someone who's been infected with the disease, of the people who they may have been in contact with, and then the attempt to make contact in any way possible with as many of those people as they can, for the purpose of letting them know that perhaps they need to be tested. If they haven't been tested, are they showing any symptoms? And to let them know that they've exposed. And really, that can lead to a whole new web of contacts that are necessary because of who the person who's been exposed may have exposed to it. So it's a cycle that tends to build on itself as more and more people are identified, and it allows the health departments, allows researchers to get a much clearer picture of how broad the scope of a particular infection or a breakout may be, and try to track it back to an event where they can perhaps contact others who've attended that event or who may have been exposed. The problem that many are running into is that many people may not or are not being responsive when they see a call on their cell phone pop up from a health department or from a phone number that they don't recognize. Perhaps they're not being as diligent as in getting back in touch when messages have been left. And that can create gaps in the ability for health officials to be able to trace and to identify how many people have been truly impacted. And so, again, the job is to continuously try to update the information, make sure that the local health departments have information about the spread of a virus, and to attempt to find as many people as possible who may have been impacted in some way, shape, or form by a COVID infection or a person who has been infected by COVID. So contact tracing is something that we'll continue to hear more and more about. States at the government health level are, again, actively setting up contact tracing activities so that they can try to manage the information within their states and provide more information about how pervasive the spread might be within their geographies. So if you have any questions, feel free to send me about COVID-19. Not that I'm the expert contact tracing, but if you have questions about healthcare and or the way technology is being used in healthcare or those types of events, please feel free to drop me a line at askaj@sykes.com. Follow me on Facebook and Twitter at AskAJHanna, no H on the end, and we'll talk to you again soon.